Hey, my name is Dr. Kyle Burtenshaw. I own Pioneer Sports and Pain Center in Kuna, Idaho. I'm a chiropractic physician. I've been in practice 20 years. So added the second chiropractor. Then due to the fact that we're getting a lot of rehab cases, post-op cases, we added a physical therapist. And then just due to my desire to always want to kind of integrate with medicine and do more, we ended up, for about 4 or 5 years, I actually tried to hire a mid-level nurse practitioner PA on my own, but there's just a lot of medical, legal stuff that you got to jump through, know how to integrate medicine, how to deal with insurance, compliance, etc. And so after kind of trying that on my own, I tried another consulting firm, which I won't name who, but it was expensive and I didn't really get the results I was looking for. But in the process, I met 𝐿𝐼, owner of Integrated Practice Solutions and 𝘉𝑒𝑛𝑡𝑒x Medical. And I can honestly say in my 20-year career, I'm a very data-driven person, data-driven clinician. I'm skeptical, not in the sense that I don't trust things, but it's like if I'm going to do something, I got to believe it and I got to know that there's some clinical efficacy and some data to support what I'm actually going to do. And when I met Lance, like I was like, this guy thinks like I do. And so I ended up hiring him to help us integrate and bring in a medical provider and bring in fluoroscope and bring in, I was already doing bracing, but he kind of helped supply bracing, got us going on hyaluronic acid injections, and then his PRP kits. And the way they do that's pretty innovative, I think, in the country, where they take it next level and look at, leukocyte-rich, leukocyte-poor, platelet-rich, platelet-poor, and actually use science to determine how they're going to treat patients instead of like everyone gets cookie cutter recipe treatment. And sometimes I find myself thinking like, okay, this, like when's like when's it going to hit the fan? When am I going to actually hit that point where I'm like, oh, here's the catch? Yeah, every time I reach out to Lance, email, phone, seminars. He's always been so generous with his time and with his knowledge. And I always come away with way more information than I even asked for. And it's definitely allowed me to be a lot better position and expand my service offerings in my practice and definitely increase my revenue significantly. So if you're looking to medically integrate or add service lines to your practice, and you want to deal with someone that's knowledgeable and also credible and uses research and data and ethics and morals in the process, I 100% support Lance and 𝘉𝑒𝑛𝑡𝑒x and IPS.